Thanks, Mike. Good afternoon, everybody. I have good news today. Our coronavirus case counts are falling, and we're making gradual progress on vaccination. First, here are the numbers. Since this time yesterday, we've identified 242 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total confirmed case count since the beginning of the epidemic of 112,526. And in addition, there are 54 probable cases diagnosed by the rapid antigen test since this time yesterday. Now, for the past week that ended on February 20th, we averaged 219 cases per day. That's PCR tests and antigen tests combined. Not so far. We expect that there'll be more that we'll hear about in the future. And of those people tested, 4.3 tested positive. To put that in comparison, the week before, we averaged 249 cases per day and 4.4% of the people tested positive. That reflects a decrease, not only in that week, but really a continued decrease since the last 2 months. Looking back on it, we've actually had about an 80% decrease in our weekly case counts since the peak in mid-December. Case counts are also falling rapidly in Pennsylvania and New Jersey and the United States as a whole. Now, that decrease, people may ask why it's happening, and I should say it's not caused by the vaccine, because we haven't given enough of the vaccine to explain that decline. It more likely reflects a pattern that is followed by other respiratory viruses, where they peak in the winter and then they get better in the spring and summer. So it's a sign that things will be getting better in the spring and summer, and even better still as the vaccination coverage increases over time. That's what's happening in the community as a whole. And in our city's nursing homes, we had only 7 cases reported last week in the entire city. That's the lowest case count we've had in nursing homes since the late summer. And that is likely to be a sign of the vaccine benefit because we have been vaccinating in nursing homes since early January. So it's very encouraging then in these difficult times, that after these difficult times, that nursing homes in the city are increasingly safe. That's what's happening with cases. With deaths, we have 13 new identified deaths since this time yesterday, bringing us to a total of 3,070 since the beginning of the epidemic. Now, in January, we declined from 92 deaths in the first week of the year to 43 the week of January 31st. I expect to hear more because there's always delayed in death reporting, but the downward trend in deaths per week is definitely clear, and that's following the decline in cases. Let me talk about where we are with vaccination. First, let me talk about the supply of vaccines to the city. This week, the doses we got allocated to us for delivery next week is as follows. We're getting an increase to 16,380 doses, first doses of the Pfizer vaccine, and 1600 first doses of the Moderna vaccine. And in addition, there's about another 5,000 first doses of the Moderna vaccine being shipped to pharmacy chains directly by the federal government, bringing us to a total of about 37,000 first doses arriving in the city next week. That reflects an overall increase from the week before and then week before that. Mainly it's in the Pfizer vaccine, which only certain sites like hospitals can handle. We would rather have more of the Moderna vaccine right now because that can be handled by just about all providers, but we'll take what we can get. Now, last week, as you may have heard, there were shipments of the Moderna vaccine that were delayed because of the weather. Those shipments are going to be arriving early this week, and we did not have to postpone any clinics because of that. We had to move some doses around, but at any rate, those doses that we would have received last week are arriving this week, in addition to the ones that we are expecting to arrive this week. What about administration of vaccine? As of Monday evening, we have got reports of vaccination on 174,092 people. That's how many people received the first dose, and 88,881 received the second dose. Of those people who got the first dose, 20% were African American, 4% Hispanic, and 6.5% were Asian. People have asked about what are the zip codes where people are being vaccinated. So now on our website, we do have a map of the zip code of residence of people vaccinated. It shows you which zip codes where we had higher vaccination uptake than others. So our vaccination uptake is highest in the Northwest, in the far Northeast, and the Center City. And it's lowest in the North and the near Northeast. Now for the week ending February 14th, total doses we administered, first and second doses, are 47,442. That's an increase of 33% from the week before. It was very good to see that. We don't have the data yet complete from last week. It takes a few days for us to get in the results of all the vaccine administrations. That's what's happening in the community as a whole. In our nursing homes and personal care homes and assisted living facilities, those facilities where the most vulnerable people live, now there's been a team that has visited to provide vaccination at least once to 95 out of 102 of those facilities. 52 of them have had 2 visits and 20 of them have had 3 visits. And they delivered 13,880 first doses and 7,115 second doses. And it's that vaccination that's occurred in the nursing home specifically that I think has been successful in reducing the number of cases that are occurring in nursing home residents. Now, back in the community as a whole, we are still in phase 1B, in which we are likely to be in until late April. The people who are eligible for vaccination in phase 1B are frontline essential workers. That's to say people who have regular contact with the public, many people, so they are high risk to acquire or transmit the infection. And people over the age of 75 who are medically vulnerable, or people who have high-risk medical conditions who are medically vulnerable. Now, this in the past week or so, we've also been asked to consider whether there are additional medical conditions that should be included in our list of high-risk medical conditions. In particular, we were asked about HIV infection. We took that question to our vaccine advisory group, and we also took it to an internal group of physicians in the health department. And we have decided to add HIV infection to our list of high-risk medical conditions for 2 reasons. First of all, we looked at the literature, and there are studies that do show that people with HIV infection are at increased risk for hospitalization and mortality for COVID. We also think that there's a Philadelphia-specific reason, and that is the people with HIV infection in Philadelphia are largely people of minority groups who are at higher risk for COVID in general because they disproportionately have other health problems. Then how is vaccine being made available? Just to remind people that all the different ways it's being made available across the city. It's being delivered by hospitals to patients that they're inviting in. Hospitals are also running some of their own mass clinics. Being made available by federally qualified health centers and other clinics, by mobile teams, and by an increasing number of pharmacies. Now, as you know, Rite Aid and Walgreens and ShopRite all have pharmacies that are offering vaccine. And we are directing people to those sites to be vaccinated if they are over the age of 75. We're taking people at our vaccine interest form who have signed up who are over the age of 75, directing them to those sites for those appointments. Please don't sign up for appointments at those pharmacies if you're under the age of 75. Then Walmart and Acme and Sam's Club are now also receiving vaccine. And there are independent pharmacies who now are enrolled. Now we're up to 8 independent pharmacies that are approved to receive vaccine, of which 6 either already have vaccine or will be receiving their vaccine for the first time this week. In addition, there are mass clinics that are being run by the health department. Now, we've been running mass clinics in the past for healthcare workers, but this week, for the first time, we started running mass clinics for people who are eligible based upon their age or medical conditions. Today, we had our first clinic of that sort. It is being run at the Martin Luther King Older Adult Center at 2100 Cecil B. Moore in North Philadelphia. And Thursday, we'll be doing the same at the Community Academy of Philadelphia Charter School at 1100 East Erie. And on Saturday, we'll be at the University of the Sciences. Now, these are not walk-in appointment places. These are for people who have appointments, and the appointments are received by us having invited people who sign up at our vaccine interest database who meet our phase 1B criteria. There are also mass clinics that be run by the Black Doctors COVID Consortium. Last week, for the first time, they ran a clinic. It was a walk-in clinic for the first time. And then upcoming next week, there will be the federally managed mass clinic at the Convention Center. It's a high-volume clinic, tentatively scheduled to start on March the 3rd to last at least 6 weeks. And the target is to vaccinate 6,000 people per day using the Pfizer vaccine. Now, people will be able to access this by being invited from our vaccine interest database if they've signed up on the database on our website or called 311 or had anybody else sign them up for them. Those people who are eligible based upon being over the age of 75 or based on having one of our high-risk medical conditions or based on being a frontline essential worker. We'll also be, for the people invited, we'll be oversampling people who live in the less vaccinated zip codes. In addition to those mass clinics, the Children's Hospital of Philadelphia is vaccinating teachers and support staff and childcare staff. Dr. Ron Caron from the Children's Hospital of Philadelphia is here to tell you more in just a minute. So what should people do who want to be vaccinated? Well, first, you may be invited by a hospital that you've been treated at in the past, or by a clinic that you've been treated at in the past, or by your employer. But if you want to make sure that you let people know that you want to be vaccinated, go to our website, www.phila.gov/vaccineinterest. Put your information in there. And when vaccination opportunities open up, we will contact you to schedule an appointment. Now, if you don't have an internet access, or you don't know how to use a computer, just call 311 and we will put your name in that database for you. So far, we have 232,000 people who have signed up at our database. We will offer vaccine to everybody there, but it's going to take some time for us to get through all of those. And then we're just reminded that we also have an organizational sign-up place at our website, www.phila.gov/businessvaccine. This is a site for any employer, for-profit or nonprofit of any size, to register the fact that they have employees that they believe are eligible on basis of the fact that they are essential workers. As opportunities for vaccination come up, we will be contacting those businesses about how to get their employees vaccinated. So far, we have 776 organizations that have signed up at that website. So much for vaccination. Now moving on to our safer at home restrictions. As you know, we have eased back our maximum occupancy for restaurants in the past couple of weeks. Restaurants that meet ventilation standards set by the health department can increase from 25% of their capacity to 50% of their capacity. So far, 99 restaurants in the city have applied to have that 50% expansion based upon meeting ventilation standards. And of those, 65 have been approved. Now, there are other restrictions we have in place in a variety of different settings, and those are set to expire at the end of this month on February 28th. In the light of the falling cases, we will be carefully easing back those restrictions. I don't have details today, but we will be announcing what those easing back that restrictions will be later this week. So what should people do now? Well, even though case counts are falling, and even though we're vaccinating people, it's still extremely important for people to wear their masks and keep up their distancing. I'm concerned that people may start to think that we're finished with this and they can throw the masks away. Not yet. We're going to have to be wearing masks for a long time. Wear the mask, keep up your distancing. No indoor gatherings. Don't get together with people outside of your household. Don't get together for parties. That's the main way the virus is spreading these days. If you do want to get together with others, do it outside with everybody wearing a mask. All the information on COVID is at our website, www.phila.gov/COVID. Thanks. And with that, now I want to turn it over to Dr. Ron Karen, who is the Chief Medical Officer of CHOP, Children's Hospital of Philadelphia, who's been a great partner throughout this entire epidemic, and who we really appreciate having stepped up to provide this vaccination for our teachers and childcare center workers. Dr. Karen.
Good afternoon. Thank you, Commissioner Farley. Thank you, Mayor Kenny and the administration for giving me the opportunity to talk to you today about the role that Children's Hospital of Philadelphia is playing in vaccinating teachers, pre-K and daycare providers, and other student-facing personnel in our city's schools. Throughout the pandemic, CHOP has consistently answered the call for help, from establishing a hotline to provide information for the general public in the early days of the pandemic, to providing cutting-edge research that's informed mitigation strategies across the country. Our goal is to play a leading role in keeping people, especially children, safe and healthy. We're particularly focused on doing all that we can do to promote the safe reopening of schools across Philadelphia. The research clearly shows that students, particularly students from lower income communities and disadvantaged backgrounds, do best when they're in classrooms. That's why we're supporting the Philadelphia School District to help provide a comprehensive testing program to help ensure the safety of students and school personnel when kids return to the classrooms. Today, however, I'm here to talk about an exciting new program we've developed in partnership with the Philadelphia Department of Public Health, Philadelphia School District, and other networks of parochial, charter, and independent schools. The initiative offers student-facing educational personnel the opportunity to receive an inoculation through CHOP's School Personnel COVID-19 Vaccine Administration Program. This program is meant to work in concert with other prevention and mitigation strategies as an additional layer of safety to teachers, students, and support staff. Now I'll provide you some details about the program. The program kicked off yesterday at the Roberts Center for Pediatric Research in South Philadelphia, and will be expanding next week to 6 school-based sites throughout the city to offer vaccination opportunities as close to employees' communities as possible. We'll be offering vaccinations 6 days a week. Yesterday, we vaccinated approximately 500 people throughout the course of the day, and we're on track to vaccinate 500 more today. These clinics will not provide drop-in service. Instead, to facilitate an efficient and equitable process, we're working with our educational partners to identify and reach out to employees who are eligible for vaccination and to provide them with information about how to register for an appointment. Individuals will be able to make an appointment online and will be scheduled for their second appointment when they come in for their first injection. We're inviting school personnel to get vaccinated in 3 waves. The first wave includes all staff who are currently working on site in schools. The second will include all the personnel that are coming back to school shortly. And the third will include the remainder of school personnel. Our plan is to complete all 3 waves of invitations this week. We're asking for educators' patience as we move through this process. Our goal is to complete the 2-dose vaccination series for all student-facing personnel in the city within 6 weeks. And the city has assured us that there'll be enough vaccine to accomplish this goal within this time frame. It may take us some time to get to you, but please continue checking your emails for an invitation to sign up and begin the process to get an appointment. We see this program as core to CHOP's mission of advancing the well-being of all children in Philadelphia. Thanks again for giving me the time to speak about the program.
Thank you, Dr. Karen. And now we're pleased to be joined by another guest, Superintendent William Hite of the Philadelphia School District. Dr. Hite.
Good afternoon, and thanks, Mike, for the introduction. And I want to thank Drs. Farley and Karen for the work that they are doing and their teams are doing with the COVID-19 education and childcare personnel vaccination program. Dr. Karen, I want to also thank you and your colleagues for hosting and providing a lot of critically important information at a town hall for staff last week as well. As you've heard today, district staff started receiving communication to make appointments for their first dose of the COVID-19 vaccine, and communication will continue to go out to additional district employees over the next several days. I've actually heard from individuals who received their first vaccine yesterday, and they were very excited with the process and very excited with the ability to get in so quickly. Getting vaccinated is a personal choice, yet we are hopeful that as many members of our staff as possible will take advantage of this opportunity, as we believe the science that supports vaccinations as another layer of safety. This adds to the other measures we've already taken over the last several months to make our schools safe as possible for staff who have been in buildings since September, as well as staff and students we look forward to having return to school buildings next week. And while our transition to in-person learning has never been contingent upon staff getting vaccinated, we do believe that in addition to the district-wide mandates around wearing masks, social distancing, regular hand sanitizing, and washing, we are creating a safer and healthier environment throughout the district that will allow for our staff, students, and school communities to feel more comfortable with our efforts to stem the spread of COVID-19. I also want to acknowledge CHOP's assistance with securing rapid testing kits that will be available to all teachers and staff working in their schools to help detect positive COVID-19 cases and further prevent the spread of the virus. As we have shown time and time again since last March, the district is closely involved with the work to help mitigate the spread of COVID-19, and we will continue to work hand in hand with the City of Philadelphia, Children's Hospital of Philadelphia, and other public health experts to ensure that all of our stakeholders, staff, students, and families know they will be safe in our buildings and ready to return to in-person learning, which is so vitally important for our students. As I've also said last week on numerous occasions over the last several months, many of our students are struggling academically and others are suffering feelings of isolation and depression after being a computer screen away from their teachers and peers for almost a year. And because of this, we need to do everything possible to work together and get our children back in school buildings as quickly as possible. So once again, thank you to Drs. Farley, Dr. Karen, for all the work that you've done to provide this critically important service to our educators.
Great. Thank you, Dr. Height. As I noted before, we are going to push Armando's translation of all of the opening remarks till the conclusion at 2 p.m. And so we're going to move now to Q&A for members of the press. We are joined today by both Mayor Kenny and Managing Director Tumar Alexander. And because of limited time, we ask only one representative from each media outlet is permitted to ask questions in the first round, and reporters are asked to limit their questions to 3 or fewer. And as usual, we are limiting the first round of questions to the topic of COVID-19. If there is time, we will do a second round. And at that point, we can take questions on other topics. So please hold them for the second round. Now let's get started by going first to Mitch Blocker of NBC 10. Mitch, you're up.
Thanks, Mike. Good afternoon, everybody. Dr. Farley, can you talk a little bit about how many doses the city is committing each week to vaccinate teachers and how you're prioritizing them? And I'm also wondering, are the doses that are being administered at CHOP right now, are those left over from January, or are those new doses?
Let me just say, we are committing to as many doses as CHOP needs to vaccinate our teachers. Exactly how many of them will want to be vaccinated is unclear, but we may be able to be providing as many as 9,000 per week. CHOP is using the Pfizer vaccine. The Pfizer vaccine is the vaccine that needs to be stored in ultra cold storage. Because of that, it's been more limited in where we can use it, and because of that, we have plenty of that available. So I'm not at all concerned about the availability of that for as many teachers as want to get it.
Moderna and Pfizer announced today that they will be able to produce 140 million more doses in the next 5 weeks. They've figured out a way to expand their manufacturing capabilities. That was announced federally earlier today. Any idea how that will affect Philadelphia's supply?
I haven't seen the announcement, but it sounds like that will increase our supply. I've been assuming that we will be increasing over time, but there's never been a commitment from the federal government beyond 3 weeks. So as I said last week, we're more or less at the point now where the greatest limiting factor is not the number of doses we receive, but just our own capacity to administer that through all the different organizations that are administering it in the city. So that's great news. That would mean we'll increase over time, but it also means we need to increase our vaccination capacity to match that.
And Dr. Height, I have one question for you as well, sir. What do these vaccinations for teachers do for the relationship between the teachers union and the district? Does that in any way, do these shots change the need for mediation or affect the mediation?
Not sure. We wanted to make sure educators were prioritized. And so I want to thank everyone who helped us to get educators into a higher priority. And while I said earlier, return to school was never contingent upon everyone being vaccinated. However, I do think that it's critically important to increase another layer of safety as a part of the vaccine program. We are still in mediation, and so this hasn't obviously had an impact on that. But the more individuals we can get vaccinated, the faster we can ensure that we can return more children to our schools.
Thank you all.
Thank you, Mitch. Let's go to David Melandra of the Philly Sports Network.
I got a question for Dr. Farley. Over the weekend, there was a report that came out that the Sixers, Flyers, and Phillies sent in requests about having fans in the stadiums starting sometime next month. Can you give us an idea where things stand with that, and any updates about fan capacity, since New York and New Jersey just announced they will have fans starting at the end of this month?
Yeah, so we did receive requests from the Sixers, Flyers, and the Phillies, and we are looking at our event limits. Right now, large numbers of fans would not be allowed under event limits, but we are likely to ease that back somewhat, effective on March 1st. I should also point out, though, that there are event limits that the state has, and we cannot be less restrictive than what the state allows. And so for all of those proposals would allow more people than what is currently allowed by the state. So I can't guarantee what will be whether those requests will be granted, because it's not in my authority. That's going to be up to the governor.
And last one for me is, so unofficially, can you say there would be a good chance of having people in the stadium for the Phillies home opener on April 1st?
I can't guarantee anything, but I can say that it's likely that there would be some fans in the stands in Phillies home opener. But how many is going to depend not just on us, but also what the state decides.
All right. Thank you.
Thank you, David. Let's go to Jeff Cole of Fox 29.
Yep. Let me start with Dr. Haidt, if I could. Dr. Haidt, where are we with mediation? You say you're still in mediation, but we've not heard anything yet from the mediator, at least the press hasn't. Are you still holding for Monday, March 1st as your return to school?
We are. Yes, sir.
Have you heard from your mediator?
We are in with the mediator, as my team is in with the mediator as we speak. So we're in with the mediator right now.
Dr. Haidt, if you do not hear from the mediator by the end of the week, or very soon, how can you return on March 1st?
Well, we'll have to make that decision, and we're taking that one day at a time, Jeff. And so once we get information from the session today, we will be making a decision on how we will approach next week.
So today is the day in which you'll make a decision on next week based on what's happening today?
Not necessarily. It could be something that happens that carries over until tomorrow. I mean, this is a fluid process, and so the more important thing is that we are still engaged in these conversations and looking for ways to solve this problem. And so, as long as individuals continue to talk and work with the mediator, I think that could be a path forward. So we will. It's a fluid situation.
Quick one for Dr. Farley, if I could. Dr. Farley. The health director in Chester County has released a document that indicates that she believes that school districts can move from 6 feet to 3 in terms of distancing in school buildings. And that seems to have prompted some districts in Chester and Delaware County, they're sharing a health department, to move forward more aggressively with getting kids back in school. What do you think? 6 to 3 in terms of distancing in schoolrooms?
We look to guidance to the Centers for Disease Control, and Centers for Disease Control is now speaking more than it was in the previous administration. And I'll double check our guidance, but my understanding is the CDC's guidance does not permit having children be there with a less than 6 feet distance, like 3 feet of distance. But I will double check that. I'm thinking that that's not what the CDC would recommend, and so we wouldn't follow that.
Thank you.
All right. Thank you, Jeff. Let's go to Johan Calhoun of Chalkbeat.
First, congratulations to everyone on beginning the process of getting teachers vaccinated. First question is for Dr. Farley. Can you give an estimate of the number of teachers who got the COVID shot this week?
Well, the only number we have is from the clinic that was held by CHOP yesterday, which is approximately 500. I can't guarantee there might not be teachers been vaccinated in other locations.
Next two questions are for the mayor and for Dr. Haidt. With some teachers not getting the vaccine until next week and still no word from the mediator, what is the likelihood that school will not happen Monday?
Well, we don't know what the mediator is going to say yet. And if there are potentially schools that are acceptable to both sides, we could have children in those schools. So what we don't know yet until we get that information from the mediator. Again, this is, as I've said from the very beginning of this back in March of 2020, there's no playbook for this. Nobody was around that was around in 1919. We have to attack this as best we can on a day-to-day basis based on the information that we have. And when we get the mediator's report, we'll see what's doable. We'll continue to vaccinate CHOP, we'll continue to vaccinate teachers and frontline school staff. And I don't have a definitive answer to you from a day-to-day perspective.
And Johan, I'll just add that it's never been a condition for individuals to return to schools. And so, as you know, the vaccines are not mandatory. And so everyone who could actually get one may not. And so for that reason, it's not a condition for the return of school. But as the mayor indicated, the mediation process is ongoing. It's fluid, and we are all committed to getting as many children back into schools as possible, as quickly as possible.
Okay, and last but not least, also I need some clarity from both of you, the mayor and Dr. Haidt. I spoke with a number of teachers yesterday spoke with a number of teachers yesterday who are grateful for getting the COVID shot, but hesitant in returning to school over safety concerns. Will teachers be disciplined if they do not show up to work for Monday over safety concerns? And if they are disciplined, what will that discipline look like?
Yeah, Johan, I'm not gonna get into just kind of what ifs, and so once we set a date and we expect individuals to return, we are expecting individuals to return, and so whatever that date is, if there are schools that are deemed safe and comfortable, and both parties are comfortable with that, then we'll be focused on getting individuals into those schools. So it is, whenever we talk about bringing individuals back, whether it's next week or sometime thereafter, that we will be expecting individuals to come to teach children, and that's what they're hired to do, and that's what we would expect.
So disciplining teachers for not showing up to work Monday, that's off the table.
I'm not saying that one way or the other, and it's not. I'm just saying we're going to wait and see what we have and what the announcement will be based on Monday, what schools we will be focused on, and then we would have to go from there. It would be an expectation that if individuals are in the groups that would be coming back, then we expect those individuals back.
And no one wants to discipline anyone. I mean, this is an adversarial situation. These are people who teach our kids. They want to be safe. We want them safe. We want our kids safe. So this continued talk about discipline is not helpful, and it doesn't move the needle forward. And you don't want to be in a situation where you try to be draconian about it, and then you have an issue going forward into the future with a bad relationship. So it's just we're going to get there, and not expecting to discipline anyone.
All right. Thank you, Johan. Let's go now to Kennedy Rose of the Philadelphia Business Journal.
Hi, everybody. Thank you so much for taking the time. My first question is for Dr. Farley. I just want to clarify some comments that you made a little bit earlier today on easing restrictions or announcing easing restrictions sometime this week. Is that for dining specifically, or was that comment just about the safer at home restrictions overall?
About the safer at home restrictions overall. We've already made the change on dining, and so I would not expect to see any changes on restaurants, but it's all the other places where we have restrictions.
Okay. And I was wondering, are you going to be making any sort of announcement about the status of restrictions on large events that are set to expire at the end of this month?
That's what I'm talking about. So that the restrictions we have now cover large events. They also cover other settings. They all expire on February 28th. We're looking at the entire list of them to see what ones we could carefully ease back on, and we'll have announcements on that before the end of the week.
Okay. And my last question is, on the topic of indoor catered events, I know you've said in the past that you're still not allowing them because there's increased risk of transmission, especially between households where people know each other. Would indoor catered events be allowed if they meet the same high ventilation standards that you've laid out for restaurants?
At the moment, no, they're not allowed. And we're still very concerned about indoor catered events. The most dangerous events where a group of people who know each other get together over food and drink, don't wear masks, and have a lot of close contact indoors. That's where we have lots of examples of transmission. And so those are the things that we would be the least likely to make changes on because we're so concerned about those particular types of events.
Okay, thanks very much.
Thank you, Kennedy. Let's go now to Laura McChrystal of the Inquirer. Laura, you're up. Your microphone is unmuted, but I'm not hearing you. Can you hear us?
I'm not sure what's going on.
Yeah, go ahead. Yep, we got you now.
Okay, great. My first question on teacher vaccinations, I understand not all teachers might take the vaccine, but do we know how many teachers and school workers there are total working in the city who would need the vaccination? And my second part of that question is how exactly will the prioritization of inviting them to get vaccinated work? For example, I know younger grade levels would be first, but will the eligible teachers be entered in a lottery, or is it first come, first served to grab an appointment?
I'm happy to take that question, Laura. So we've invited about 25,000 teachers to sign up for a vaccine appointment, and we're going to invite about another 10,000 more. As I mentioned in my remarks, these are school personnel coming from 4 different networks: the School District of Philadelphia, the Archdiocese schools, the independent schools, and the charter schools. We're also working with PDPH to identify early childhood program workers, and they're providing us lists of those employees as well. All told, as I said, it's about 35,000, and we're hopefully in the next day or two, we'll be done with sending all of those invitations out. In terms of your second question about the prioritization, we are doing this in 3 waves. The first wave is school personnel or early childhood program employees who are currently in classrooms, in-person settings with children. They were invited first. The second wave is school personnel that are planning to come back to be in in-person teaching environments. That's mostly the K through 2nd grade teachers. And then the third group are individuals who are not student facing, but at some point we will want to immunize those individuals as well.
Laura, you set?
Thank you. My next question is for either the mayor or Dr. Farley. With the Black Doctors Consortium 24-hour event over the weekend, I'm wondering, what was your reaction when you saw photos and videos of the people in line in the freezing cold waiting for their vaccines? And, did it make you think at all that the city should have been more involved in doing that clinic or, planning it to help out in some way to prevent that?
No, this was the first time. First of all, there were 4,000 vaccinations. So don't lose sight of the fact that it was a very successful event. It reached a lot of people in from areas that would not normally be reached. The weather was a problem, although there were 3 lines. One was a 75-year-old and up line. Those folks were almost like an express line, and they were pretty much ushered in to the warm weather. There was a line that had preordained appointments, and those people moved pretty quick. And then there were people who were walk-ups, and the walk-up was a first-time pilot that they've done. I think it was successful. It was inconvenient for some people based on the weather, and we'll correct things going forward as we see things that need to be corrected. So I think overall it was a successful event, and if she's going to do it again, or the doctors are going to do it again, we're already in conversations with them to how we can keep that from happening again. But again, 4,000 people got vaccinated, so I would consider it a success.
Okay. And my last question is about the RFP for contracts funding for vaccine clinics. Dr. Farley, I know you had said last week that there were already some submissions. Has anyone already been contracted with for that funding?
And we have 8 submissions, and we are reviewing them. We have not contracted with anybody yet.
Thank you.
All right, thank you, Laura. Let's go to Martin Pratt of Philly YBN.
Thank you. These 2 questions are for Dr. Farley. Dr. Farley, based on what Chop just mentioned, it sounds like it's a pretty good strategic alliance or partnership. Is the health department investigating how to partner? Philly, we have world-class health facilities here. Is the health department investigating how to utilize other hospitals in the same way you've done with CHOP?
Well, in many ways, we already are doing that. So the hospitals are inviting their own patients in to be vaccinated, but they're also running mass clinics, not necessarily targeting an employer group, but often a neighborhood group. And so some of those have been publicized, some of them not. I know that Penn did one in West Philadelphia, that Jefferson has done some in Center City. And so, yes, we have asked them to reach out beyond their walls and beyond their patients to vaccinate people, and they're doing that.
I think Jefferson was dealing with, I believe, a lot of folks in Chinatown.
Thank you. That leads me to the second question, Dr. Farley. It seems to be many people in the community have been asking this question about the 12 healthcare or health centers owned by the city. Are you going to activate them at any point to do vaccinations? And if not, why?
So all of the city's health centers, and there are really 8 of them that are primary care centers, they're all vaccinating right now. They're inviting in their own patients. They will also be starting soon to be doing some Saturday clinics and inviting people, but they're starting with their own patients. Like they serve like the other federally qualified health centers and other health clinics, where these are they're inviting patients that they have a long-standing relationship with, and so it has the advantage that for people who are maybe apprehensive about vaccination, they can talk to a doctor they trust, and they're more likely to get vaccinated. It's a disadvantage that these are not mass vaccination sites. They don't do 500 people a day, so it's a fairly low volume, but an important group to be vaccinated. But so yeah, they're all underway.
Can we possibly get that in this week's press release that you guys released, just a list of who the health partners are and what each center is doing, if that's possible?
Yes, we'll be putting out a report that will show the vaccinations by provider. We consider our health centers would be one provider. Each hospital would be one provider.
Thank you.
All right, thank you, Martin. Let's go to Mike Donofrio of the Philadelphia Tribune. Mike?
Thanks. So first, I guess, Dr. Farley, can you guarantee that the city's new mass vaccine sites will help reduce the vaccine racial gap and ensure more African-American Philadelphians get the vaccine? And if so, how long do you think it will take?
I can guarantee that those clinics will serve populations that are much more likely to be African-American than the populations that have been vaccinated so far. Because we have many different channels that vaccine is being administered, we have a goal to be vaccinating people in proportion to their racial distribution in the city. I'm not sure that those mass clinics are going to change that goal. We have to do it through many other ways.
And the administration may not have a racial breakdown of those who receive vaccines during that the 24-hour clinic over the weekend. But have you heard of any encouraging information or anecdotal evidence, at least at this time, that more people of color and people from those targeted zip codes received more of the doses?
Well, anecdotally, I was there, I think, twice. The folks that I saw there being vaccinated were the most part African-American. Many were elderly. The people in line was a bit of a mix of folks. But the people, I think there was a good percentage, and I couldn't tell you what it was because it was, again, just my viewing of it. The goodly percentage of the folks there were African-American.
All right. Dr. Farley?
Yeah, and to say we will be releasing data on the racial breakdown by provider. So not by individual events like that, but by provider. And so I would certainly expect that the Black Doctors Consortium is going to be a high proportion of the folks that they vaccinate is African-American, which is an excellent thing.
All right. And then it's been 2 months since the vaccination program began. At this point, how would you just grade the administration's effectiveness in ensuring equity for all groups getting the vaccine, and especially, for African-Americans?
I'm going to let the educators on this call do grades. I'm not a grade guy. And I'll say what I've said before, which is that we want to vaccinate people as quickly as possible. We want to vaccinate the people so we can save the most lives, and also do it with racial equity. We got more work to do in all of those. The numbers speak for themselves, that we are under vaccinating African-Americans and people in other minority groups. We got more work to do on that.
I do believe that the 3 that are opening, one at Cecil B. Moore, and then I think Cumberland or Erie, right, in the east side of North Philadelphia, and in West Philadelphia will get us what our aspirational goals are. In addition, the Tier 2 site, which has not been selected or announced yet, would be located in an area where we're trying to continue to reach those goals. I think the most important thing is that wherever we're doing it, it's in neighborhoods and accessible by public transportation or by foot.
All right. Thank you, Mike. Let's go now to Natasha Brown of CBS 3.
Hi, this question is for Dr. Karen. Just wondering, you said 500 teachers were vaccinated yesterday, another 500 today as well. With so many teachers that you do have to get through 35,000 or so that you're saying, including the parochial teachers, charter school teachers as well, how many are you hoping to vaccinate on any given day? And also with the 6 other school sites that are going to be used for vaccinations, is CHOP going to be overseeing those sites as well and delivering the vaccinations, or if you can help me understand that.
Sure, yeah. So CHOP is going to be staffing all of the vaccination sites, both the one at the Roberts Center, as well as the clinics that we're setting up in these 6 different schools throughout the city. We just started planning for this 3 weeks ago, so we weren't able to stand up 7 clinics, in 3 weeks. So this first week, we started with the Roberts Center, and we have the capacity to immunize 3,000 individuals or administer 3,000 doses in the first week. By week 2, we'll have the capacity to immunize 9,000 employees a week. And currently, we're planning to do that for 2 weeks. We'll see what the uptake of the vaccine is. We hope that all 35,000 decide to get the vaccine. But we know that some people may have already gotten the vaccine through another route. Some people may have been infected with COVID and decide that they don't want to get the vaccine, even though the recommendation is that those who've had COVID still get the vaccine in order to ensure that they have immunity. And there may be some who decide that they don't want to get the vaccine.
Okay, thank you very much.
Thank you, Natasha. Let's go to Rob Kustner of NBC 10.
Mr. Mayor, back for another sports question. It's been a little while. So Dr. Farley just acknowledged that it's likely, but the state still would need to check in on Phillies and home opener. Have you had conversations with the Phillies? And secondly, when do the conversations begin with you and the state regarding a final decision? Because obviously opening day is not too far away.
I have not had conversation directly with the Phillies. I have talked with the Flyers and the Sixers. I have not had conversations with the state health officials, which I leave to our local health officials to talk to them. Again, one of the reasons I think why we've been successful in keeping the health cases down and the percentage infection down and getting people vaccinated and starting to pull out of this is that we follow the science and the medicine. And look, I want to go to a home opener as much as anybody. I mean, I want to go to spring training again this year, but I'm not going to go because I don't think it's safe for me and my age and my situation. So yeah, I mean, I would love to see some people in the ballpark safely for opening day. It's a wonderful beginning of spring and a thawing out of all this stuff we've been through with the past winter and the last year. So yeah, I assume there's going to be conversations soon with the ball team.
Thank you.
Rob, are you good? Okay.
All set.
Very good. Let's go to Isabel Sanchez of Telemundo.
Hello, Armando. Solo necesito brevemente una traducción de lo que acaba de decir el alcalde en referencia a los deportes y también parte del comentario del Dr. Farley de que sí recibieron, ¿no? Como se preguntó anteriormente, comunicación, pero que esa decisión realmente va a tener que depender de lo que diga el Estado.
Armando, you have to unmute.
Isabel, tenemos una pregunta para el alcalde y una para el doctor Farley con relación a los deportes. ¿Qué exactamente es lo que quieres preguntarles a cada uno? Por favor.
Claro, Armando, no, inicialmente su opinión a ambos acerca de la posibilidad de tener fanáticos de regreso en los estadios para Opening Day y si tienen alguna comunicación con los equipos de la ciudad de Filadelfia.
¿Esta es para el alcalde?
Para el alcalde, como lo acaba de responder, y la comunicación con los equipos de Filadelfia para el Dr. Farley.
Bien, gracias. There's a question for the mayor and there's a question for Dr. Farley that has already been covered, but this is for the benefit of the Spanish-speaking audience. The question for the mayor is, what is your opinion about the possibility of having the fans back at the stadiums for the opening day? And for Dr. Farley, if in this regard, have you been in contact with the teams in Philadelphia?
Well, let me say, as I just said earlier, there's nothing more that I like than going to an opening day at the ballpark. It is the beginning of spring. It's the thawing out of all we've been going through, and hopefully there'll be fans in the stands. I would probably predict that there won't be a full house. We'll probably have a certain number that's allowed by the state and concurred with by the department and Dr. Farley's folks. But I'm looking forward to getting back to normal.
El alcalde nos dice que no hay nada más que él quisiera que empezar el día en los estadios para la primavera después de todo lo que hemos pasado tan duramente y que espera de que estén los fans en presencia completa, pero que estamos supeditados a lo que nos indique obviamente el Estado y que vamos a estar en contacto con ellos para saber cómo será esto. Y la respuesta del Dr. Farley. Dr. Farley?
I'm sorry, repeat what the question was for me specifically?
Yes, if you have been in touch with the teams, the sports teams in Philadelphia about the possibility of reopening or having opening day with full attendance of the fans at the stadiums.
Yes, we have gotten requests to add fans to the stands for both the Flyers and the Sixers as well as the Phillies. And we're looking at those, but in order for those to be granted, there would have to be changes not just in the city's rules, but also the state's rules.
Efectivamente, Isabel, hemos estado en contacto y hemos recibido pedidos de los equipos deportivos de la ciudad, incluyendo los Flyers, los Sixers y los Phillies, que nos han pedido, obviamente, que se pueda tener a los fanáticos asistiendo a los eventos deportivos, pero obviamente estos cambios quedan supeditados no solamente a lo que podamos hacer en la ciudad, sino lo que nos indique el Estado también. Muchas gracias.
Thank you.
Isabel, are you all set?
That's all I need. Thank you.